Welcome in Zay's sexual health world. Let's follow Zay together in a challenging journey to become a perfect healthcare professional. We are going to see how to apply the values of human rights and ethics in day-to-day clinical work. Oh, Zay has already to face a first obstacle: access to healthcare. Factors such as geographical location, income level, and insurance cover can affect a person's ability to seek and receive sexual health services. Also, low medical density increases the cost of care through the cost of transport and the opportunity cost of travel time and waiting time. Oh, there is a second obstacle for Zay: socioeconomic disparities. In fact, people from lower socioeconomic backgrounds often face greater barriers. This includes limited financial resources, inadequate health insurance cover, and reduced access to preventive care and health education. One more obstacle: racial and ethnic disparities. This includes discrimination, cultural barriers, language barriers, and implicit bias within the healthcare system. Cultural factors such as attitudes towards self-care, privacy concerns, and taboos can have an impact on care. Let's continue. I hope that this was the last obstacle. Oh no, there is another one: gender diversity. That's true. Women may face particular challenges in terms of reproductive health, access to contraception, and maternal health care. Men may be less inclined to seek preventive care or mental health services because of societal expectations. People with other diverse gender identities often face barriers to high quality and gender-affirming sexual health care. Oh, last but not least, we have cultural and linguistic diversity. This can be achieved by using either linguistic or cultural mediators. Patients from different backgrounds may also have different beliefs, values, and preferences when it comes to health, and this must be respected. Congratulations, Zay! All the obstacles have been overcome. So let's move on to the next level. Oh, what is happening here? A demonstration about discrimination in healthcare? This is a new challenge for Zay. Let's see how to recognize discrimination and cross this demonstration. Oh, this group of people claim to be aware of stereotypes and prejudices. Sexual health professionals need to be aware of their own prejudices and stereotypes, which can influence their interactions with patients. Great, we can jump over it now. Oh, what do we have here? Listening to patients' experiences. Be alert to any comments, attitudes, or behavior that may marginalize or stigmatize certain groups such as LGBTQIA+ people, people with disabilities, aging people, or people from specific cultural backgrounds. It is also important to take into account people's unique constraints. Complying with certain medical prescriptions can be complicated depending on the needs of jobs, family, and many other factors. Let's see what is written here. Fight against disparities in care. Disadvantaged patients may exert less pressure on doctors, which can lead to a lower standard of care. Some patients may also need more time to explain their situation. Here is the next group of people. They ask to fight against microaggressions. Microaggressions are subtle, everyday actions or comments that can have a negative impact on individuals or groups. They can include making assumptions about a person's sexual orientation or gender identity, using inappropriate language, or dismissing their concerns. Understanding intersectionality? Oh, that's true. Individuals can be affected by several forms of discrimination that interact, overlap, and reinforce each other. For example, a Black trans woman may face additional barriers in accessing sexual health services tailored to her specific situation. Great! Now that Zay is aware of the different kinds of discrimination and how to recognize them, let's go to the final step to become the perfect healthcare professional. Let's see if Zay chooses the good ingredients. Suspend judgment in professional life. Take account of the patient's environment. Respect the patient's choices and promote their autonomy. Adapt information, make it accessible and inform patients of their legal rights. Respect privacy and establish confidentiality and trust. Practice centering a human rights perspective in their day-to-day relationships. And this throughout life. Good job! Zay is now an expert. By recognizing discrimination and implementing strategies to combat it, sexual health professionals can create a safe, inclusive, and positive environment for all patients.